Welcome back to the 7th and final episode of The Truth About Pet Cancer. I'm your host, Ty Bollinger. Over the course of the past week, I'm thankful that we've been able to share with you some potentially life-saving information that will help you enjoy a long and happy life with your pet. If you missed episode 6, here's a brief recap. In episode 6, we learned from experts discussing using cannabis to treat pet cancer, sharing the stories of their own pets and their patients. We learned specific methods to incorporate essential oils into your pet's daily health regimen and even their oral health, and we examined the science of homeopathy and homotoxicology. We also investigated why much of natural medicine is currently not included in the educational curriculum at both medical schools and veterinary schools. We've saved the best for last. In this grand finale episode, we're going to learn some secrets from Asia and discover the ins and outs of Eastern medicine. During this episode, you'll learn which roots, exotic plants, and herbs from the Amazon are the most potent at fighting cancer. You'll get an up-close look at an innovative surgical procedure which is helping pets stay cancer-free, and you'll also learn about some other high-tech machines that are diagnosing and treating pet cancer without all the side effects. And last but certainly not least, you'll hear some encouraging words from pet owners about their amazing survivors and thrivers. We've got a lot to cover in this episode, so let's get rolling. Did you know that you can also use acupuncture on pets? Let's hear from the man who had the first acupuncture practice outside of China. You were one of the pioneers in acupuncture.
Yeah.
Right? So there's scientific basis in acupuncture, specifically with neurophysiology, right?
Absolutely. You know, my master's degree was in neurophysiology. 3 years out of veterinary school, after 3 years of practicing on all creatures, great and small, up in New Hampshire, each day I didn't know if I'd be treating a dog, a cat, a cow, a horse, an alpaca, a goat, whatever. And after 3 years of that and seeing the benefits of Western medicine, but also seeing the animals that didn't respond, that's when my passion was, okay, what else can we do? And there was one initial lecture by my first teacher, Dr. Shelley Altman from Los Angeles, on acupuncture. And so I went there, and in the first hour of this 2.5-day workshop, he went and started explaining it based on science. And that little inner voice, that light bulb came on in me, and that inner voice, I just heard, this is your journey. And because what I saw was that the applied neurophysiology, that this is what acupuncture was, that the neurophysiology that I learned in my master's degree was being applied through acupuncture. And that's where I got so excited about it. And that's where I went and started pulling together all the research on it. And this is before there were human acupuncture schools. This is before anything. This is just right after Nixon and Kissinger had opened the doors to China. And there was this, interchange and exchange of information. And then there were only like 30 veterinarians in North America doing it. And unfortunately, most of them were doing it based on TCM, traditional Chinese medical theory, which is great and awesome, but Western medicine wanted to know the science. And so I brought in the science, and that's how I got first started with that. And I was at the Animal Medical Center, the largest animal hospital in the world, and I presented the first lecture that I ever gave on the scientific basis of acupuncture. And I was so naive, and idealistic, I was just wanting to help animals. And I presented the latest research and what was available at that time in 1982. And the head of neurosurgery came up to me and said, "Hi, I'm going to do everything I can to make sure you're not here." And I went, "Oh, thank you." But then the head of Animal Medical Center, who is a real visionary, he came up to me and says, "This is the first time it's been explained scientifically. What I'd like to do is send the head of orthopedic surgery up to your practice and see if what you're saying is for real, and to hang out for a few days." I went, "Oh, that'd be great." I just excited that animals were getting better, So he came and he spent an afternoon with me, and he goes, "I don't need to spend any more time. Every animal that came in today, we would have euthanized, and they're all better. You have to be at AMC." And so we did an experiment, and they said, "Okay, you'll come down, and what we'll do is, after they've gone through all the Western medicine and surgery and diagnostics at the #1 animal hospital in the world, and we're recommending euthanasia, we'll refer them to you. I went, oh, great, you know, okay, you don't have a double-blind placebo-controlled trial, but here you're saying these animals are recommended for euthanasia. Nothing more can be done. Now, many of them I did turn down because I didn't think acupuncture would be appropriate for that case. But the ones that I took on, 80% of them improved and lived longer, happier lives. One of them happened to belong to a stockbroker that was a donor to Animal Medical Center because it was a nonprofit center. They had recommended, the dog had multiple compressions in the spinal cord and the neck and the back, typical of pugs. It was a 12-year-old pug. I said, I'm sorry, we need to euthanize. And they said, but, he says, isn't there anything else? He goes, well, we have this veterinarian here who's doing some acupuncture. I don't believe in it, but if you want to try it. He goes, yes, I'd like to. After 8 treatments, we got it off all the steroids. Dog was running and playing. It was wagging its tail for the first time in months. And it was strong, it could stand up. Before that, it was falling down, it couldn't stand up anymore. And it was running and playing. That dog lived for 3 more years. After the 2 months of acupuncture and the dog was off steroids and doing well, he said, Alan, why isn't this place packed with clients? I go, well, we're just doing it one by one. They're paying me $15. You know, I wasn't doing it for the money. I was driving from 2 hours upstate New York down, you know.
That didn't even cover your gas.
Yeah, no, it didn't even cover the gas. So he said, you know, I donate here. If they want any more donations, I want to have a department of acupuncture. And he told them that. Next thing you know, we had the first department of veterinary acupuncture outside of China.
Acupuncture obviously has been a medical treatment and a medical philosophy that's been around for thousands of years. You know, the efficacy of acupuncture has been borne out in more conventional Western research. You know, what I tend to use acupuncture for within the realm of cancer patients, you know, we use it in many ways to sort of help improve their quality of life, their sense of well-being. So improve their appetite, improve their energy level, help with stress and anxiety. Oftentimes, when I'm looking specifically to treat cancer, that's when we're going to start to integrate anti-cancer Chinese herbs. So, you know, from a Chinese medical perspective, cancer is often described as stagnation or phlegm or interruption of energy flow, and you know, Chinese herbs are sort of categorized as what we would call either blood movers or something to break up stasis. And these are the herbal formulas that you tend to use to help treat cancer. And it's fascinating when you look at some of these herbal formulas that have been used for these purposes for thousands of years, and then modern medical science takes these formulas and starts to pull them apart. And lo and behold, they start to find these really specific anti-cancer compounds in these formulas. It's just that, you know, thousands of years ago, the Chinese didn't have the vocabulary that we now use to describe that, but they sure did know which plants to use.
Because the thing with Chinese herbs is what we can do is we can actually look at the mechanisms that we know about cancer now and actually pick herbs that have constituents in them that actually affect that. So there's an herb called Chayu, which is Blueperum is the name of the herb. And Blueperum actually stimulates the immune system and has effects on cancer. In one herbal formula, though, we can put herbs that cut the blood supply to the tumor, that stimulate the genes to say to the cell, you should die, that wake up the mitochondria. It's a really big deal in cancer because one of the first things the cancer cell does when it becomes immortal is it turns off the mitochondria. So the mitochondria makes all the energy. Like, why would a cell do that? Well, the reason it does that is because the mitochondria has the power to kill the cell when it goes off doing something it's not supposed to do. So the cancer cell says, well, we've got to live, so we're going to shut off those mitochondria and put them to sleep, because if they wake up, they're like, hey, what are y'all doing around here? That's not cool. And then they just cause the cell to die. So if we can wake up mitochondria with food, if we can wake up mitochondria with herbs, if we can wake up mitochondria with drugs that haven't been developed yet but are in the pipeline they're working on, these are all new strategies for us to treat patients who have cancer.
And we have to understand what actually promotes health. And at the moment, we're led to believe it's fake industrial food. Absolute rubbish. My early training also involved Chinese medicine, where we were taught, of course, that the early Chinese doctors were only paid if their patients stayed well. And in Western medicine, we're only paid if our patients are ill. How bad is that?
I talked to one person who was like a big skeptic on a veterinary school, and it turned out he didn't like the word qi. he didn't like the word qi because it's not objective. You can't go to the pharmacy and get 600 cc's of qi and then go inject it into rats to see what it does. Yeah. But I said, the word qi just means stuff. In Chinese medicine, it just means stuff. Two guys sat in a room with a live body and a dead body, and they said, we're going to study them. We'll look at them for a day, and we're going to see what the difference between the live person and the dead person is. And at the end of the day, after they did that and they talked, they said there's some stuff in the live guy that's not in the dead guy. And that stuff is called qi. And so the word qi just means stuff. And so since those guys did that, we've been naming all the different stuff in the body. So we have cytokines, and we have the immune system elements, and we have red blood cells and white blood cells and genetics and genes and all this stuff, right? It's just stuff. Nature's got the stuff. Yeah. What people need to do is figure out how it fits together. And that's what integrative medicine's about.
I love that quote. Nature does have all of the stuff that we need. We just need to figure out how it all fits together. One couple that's been working together to help spread the light of truth about cancer to the world is Amazon John Easterling and Olivia Newton-John, both of whom are huge animal lovers. They have dogs, cats, horses, chickens, you name it. As you might be able to tell from his name, Amazon John is very familiar with the Amazon rainforest, where he actually traveled for the first time back in the 1970s looking for lost cities of gold and Inca treasure. He also founded the Amazon Herb Company in 1990 to promote the health benefits of botanicals from the Amazon rainforest. Here they are explaining 3 key concepts about successful cancer treatments, as well as some specific Amazon herbs that not only have anti-cancer properties, but also can help heal wounds in your pets.
When you look at cancer, you really want to look at, I always look at 3 things anyway. First of all, you want to compromise the health of that cancer cell. And then you want to attack it with their own, immune system, phagocytosis, macrophage activity. And then you want to be able to disperse that. As those cells die, you want to move that through the lymphatics and get rid of it. So things like a graviola, for example, which is full of acetogens, and it has the ability to go to an attraction to a cancer cell and actually cut off the blood supply. It's an anti-angiogenesis effect, they call it. And then if you kick up the immune system, again, things like cat's claw, for example, really kickstart the immune system. And then to detox and move that, debris, the cellular debris, out of the body as all that happens. It's important and really important in pets.
And I have one that's my favorite that we use on our dog if she ever gets a cat, or on our horses too. It's called Sangre de Drago, blood of the dragon, dragon's blood. It seals up the wound from the inside out, and it's antiviral. And I use it if I'm getting a sore throat, if I'm going to do a concert, I gargle with it, or I put it on a cut, or if I'm getting sick. But for the horses and the dogs and our cat, we've used it many times when they've had a scrap or they've cut themselves. And it's incredible, and also to put a drop in their water if they're not feeling well. We have chickens, and we had a chicken that was quite old, and she got really sick, and we were kind of told she probably would die within a day or 2, but we didn't give up on her, so we got a dropper, and we put a couple of drops of the sangre in a squirty, syringe, and put it down her throat, and the next day she was running around, and she lived another couple of months, and she was quite old. So sangre is remarkable.
Yeah, we have a chicken, where we live, we have a chicken whisperer that lives in the area. I call her Chicken Whisperer.
Yeah, she's amazing.
She's all about chickens. She comes and looks at your chickens, and she knows what's wrong with them. She's like a chickenologist. I mean, she's an extraordinary human being. And even she said this, just make it. She's got a day or 2 to go, and so we introduced her, the Chicken Whisperer, to some Amazonian herbs. So let's get some probiotics, some enzymes, some Sangre de Drago in this chicken. And I don't know a lot about chickens, but jeepers, it recovered and kept on living. Sangre you put right in the wound. It stimulates the migration of fibroblast cells, which is the wound healing cells. So any cut, scrape, abrasion, you just need to have it in the medicine chest.
I hope you're learning that indeed, nature does have an amazing medicine chest. But don't worry if you've never heard of graviola, or uña de gato, which is cat's claw, or Sangre de Drago, which is dragon's blood. These are all Amazon rainforest herbs. I'll bet you have heard of ascorbic acid, better known as vitamin C.
I use a lot of IV vitamin C in my practice, but we don't know exactly what it does. And it's an interesting compound because it helps eliminate toxins. It protects the cells that are in the body. the cancer cells themselves can't metabolize vitamin C properly. So when a high dose of vitamin C goes inside the cancer cell, it creates an oxidative reaction inside the cell that kills the cancer cell. So in essence, it works like a chemotherapy agent, but it has less side effects.
There's also an interesting theory came from the Reardon group that did the IV vitamin C on cancer as an unhealed wound. And if you look at things like osteosarcoma, they frequently occur in places where there's been a wound. So there's been damage. Liver cancer shows up where there's been like a chronic inflammatory condition in the liver. It's an unhealed wound.
Vitamin C has been shown and now finally proven to be at high levels given intravenous toxic to cancer cells while being supportive to normal collagen production. So they feel good, they get their appetite back, and we're starting to destroy the cancer. Doesn't cure it, but it's a power play against the cancer.
Well, the vitamin C was heavily researched by Dr. Linus Pauling, 70 years ago? We've known that for a long time.
For a long time. Now, the caveat with dogs is dogs in nature kind of make their own vitamin C. They don't go climb orange trees. I'm not into giving vitamin C to a normal, healthy dog because you could suppress their innate ability to make vitamin C. But we're no longer in nature. So they become very vitamin C deficient over the generations. That's why we would use something like high levels of vitamin C, because, if they were making their own vitamin C, they probably wouldn't have cancer.
As far as the supplements, D and C are basic. But, selenium, there's actually some classic studies on selenium that got buried where they were finding 50% decrease in metastases with just supplementing with selenium.
So, vitamins and minerals like selenium are essential to your pet's overall health, especially in light of the fact that most kibble does not contain the organs, the bones, the cartilage, and the other excellent sources of vitamins and minerals that animals in the wild are getting. Here's world-renowned veterinarian Dr. Marty Goldstein discussing supplements in more details, especially a pet's need for good fats.
One of the other things that I think the pet food industry has done that's derogatory for animal health is they've taken all the organs and glands out of their diet. In nature, a dog would eat thyroids, pancreases, thymus glands, brains. We've taken that out. So we've been using concentrated glandular supplements to make up for the deficiencies they've inherited by us taking that out of their diet. And we won't just give a piece of liver to make up for the deficiencies. We will give them in supplement form. The true definition of a supplement is a concentrated food to make up for the deficiencies in the food. Supplements don't supplement the patient as much as they supplement the diet on its deficiencies. I would say that essential fatty acids and omega-3s is the number one accepted supplement right now in conventional veterinary medicine for immune system support, anti-inflammation, anti-allergy, health, heart disease, kidney disease. We put almost every single pet, even from when they're young, on an essential fatty acid, omega-3, usually fish oil or krill oil supplement. Make sure it's not rancid, it's high quality. Absolutely. And that was proven in the studies on lymphoma by Greg Ogilvy, that the DHAs and the omegas were very immune supportive. Fats supply the growth, supply energy to normal cells while they starve energy to cancer cells.
Fats are a little bit tricky, and there is no one size fits all. So fats are really better fed raw. When we cook fats, they go under peroxidation, and it definitely changes the chemical structure. So we see a lot more pancreatitis with pets that are fed like a high-fat cooked diet. So that's why, we always get the after Thanksgiving and they gave them a bunch of gravy, or they, we'll dump the cooked bacon grease onto the dog's food. If you fed them the raw bacon, you probably wouldn't have a problem. But once you cook it, it becomes more of a problem. Me personally, I am a fan of coconut oil. I think we need the medium chain triglycerides. I'm a fan of omega-3 fish oils, but we have to be very careful with whether or not those are rancid and what kind of containers they're in and how long they're sitting on the shelf and how they're stored. There is some need for, not as much need as people think, but we need healthy omega-6. So having some sort of a seed oil in their diet. Do they need all of these every single day? No, but should it be part of their diet overall? I think so.
Are there certain superfoods that you would recommend for pets to eat?
Sure. Probiotics, of course, and coconut oil. Absolutely.
Coconut oil.
Now, coconut oil is high in fat, but it's excellent for cognition and memory. It is really a superfood. Green leafy vegetables, yellow-orange vegetables, omega-3 fatty acids, like fish oils or plant oils or whatever, and coconut oil.
Coconut oil truly is a superfood, but there may be a hidden hazard lurking in some fish oils today. Let's learn more about this from nutritional expert veterinarian Dr. Peter Tobias.
Most omega-3 fatty acids are sourced from fish, and fish these days is full of mercury. Sardines, small fish that is also used, is prone to buildup of strontium from radioactive pollution, let's say in Fukushima, and I have some articles on my website about that. When it comes to plant-based sources, we discovered that most of them are GMO, and when they're harvested natural, let's say algae and plankton, there may be little micro pieces of plastic in it, and it's very difficult to separate. So again, there's a problem. When it comes to krill, it would be a great source, except it is the start of the food chain for whales and other animals, and overfishing of krill can be a serious problem. So we went around in circles and couldn't really discover or find a good source until I started learning about calamari or squid, and learned that calamari has been increasing in population since the 1950s because the population of fish has been decreasing. And it's also low on the food chain, so it's low in toxins. And if we harvest it, we are actually not causing any harm because there is overpopulation of squid. So in my mind, that's what I take. It is rich in EPA and DHA, and it doesn't smell or taste as fishy as the fish oils.
The big hurdle that people come up against when they start trying to figure out how to treat their pet with cancer is supplements. Because you can go on and you can Google supplements for cancer, and you're literally going to get millions of hits. And while clearly there's stuff out there on the internet that's just completely bogus, there's a lot of stuff out there that's legit. I mean, there are thousands and thousands of herbs and supplements that have been demonstrated to have anti-cancer properties. Where do you go from there? You've got this list of thousands of supplements that appear to be beneficial, and if you or I are sick and you make the decision that you want to take 40 supplements in a day, well, then you can do that. But clearly that's just not practical in a dog or a cat. So we have to figure out, how do we whittle that down to something that's doable? So one of the ways that I do that is I look for a really good comprehensive combination supplement. And there are a number of them out there, and which one is right for any individual is something that I need to talk to the individual pet owner about. But when you look at these combination supplements, you're looking at supplements that may actually have 30 or 40 different anti-cancer compounds in them. So that way now you can give your dog or your cat 40 different things, but you're just giving one supplement. So that's a really good way to get started, is with a good, robust combination supplement. And then it just becomes it's a fine-tuning issue. I very commonly will put these patients on omega fatty acids or fish oil, partially because they're so supportive of the body, but also because they have anti-inflammatory and anti-cancer benefits to them. I like to look at probiotics because, again, if we're supporting the digestion, we're supporting the immune system, and we're supporting the whole body. And then we start to go from there, and we talk about cannabis, we talk about Chinese herbs, we talk about other things that may specifically benefit any animal's individual given cancer. But the advice that I would have for somebody that's really just getting started here, if you don't have immediate medical advice, try and find a really good, well-constructed supplement, and then really just kind of work it from there.
Please remember, due to the fact that kibble is cooked, almost every pet that is on a kibble diet is likely deficient in vitamins, minerals, probiotics, and enzymes. So that's a good place to start with a combo supplement. Once you've done that, then maybe we can talk Amazon John into formulating a pet super nutritional product based on Amazon rainforest herbs. Wouldn't that be fantastic? Earlier, we heard from Amazon John, who mentioned graviola and cat's claw, which have not only medicinal bark and leaves, but also medicinal roots. One other root that is pure medicine is turmeric.
The other thing is turmeric, really important. Turmeric is curcuma longa, curcumin, and turmeric is an excellent antioxidant It stains everything orange, so you have to be careful, but we mix it in food. It's really, really good.
Why is it so good? Is it because of the anti-inflammatory effects?
Most anti-inflammatory, anti-parasitic, antibacterial, antiviral, anti-everything. It's great.
It is awesome.
Yeah.
There's a lot of studies that have been done on the cancer effects of turmeric as well.
Yes, 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 absolutely, anti-cancer as well.
The amazing thing about turmeric, Ty, is that when you go into the literature on Medline, there's over 10,000 studies that have been published. And what's so cool about this is that the vast majority of them, I'd say 98%, are in the animal or cell model, which is still the animal model. So those who are looking at it through the lens of what's good in veterinary medicine and nutrition, technically it validates its use for animals, because I've indexed myself alone, spending all this time, over 3,000 studies on the health benefits for over 800 diseases. Almost all of those studies were done for animals. So technically, those with pets who are looking for alternatives to highly toxic drugs, let's say osteoarthritis, you look at the latest review on what has been shown to be proven effective for osteoarthritis, pain, and all that for pets, they'll mention things like NSAIDs and COX-2 inhibitors, but it's the truth of the matter is that it's actually the natural compounds that are most affirmed to be safe and effective. So I would say that turmeric would be one of those herbs that if I was really wanting to heal my pet, I'd probably be looking at that for an alternative to drugs.
Curcumin, turmeric, awesome. Anti-cancer, anti-inflammation. It's a big buzzword right now. We have 2 products here that are high quality turmeric containing. I love it.
There are so many anti-cancer foods, it's hard to name just a few, but turmeric is very potent, treats inflammation, prevents cancer, and sulforaphane, which is from broccoli sprouts, is one of my favorites as well. It has anti-cancer and anti-Parkinson's / Alzheimer's potential as well.
So once we've sorted out supplements that will help support the patient's body as a whole, then we turn our focus to what can we do in a natural sense that is actually going to have definitive anti-cancer properties. And there are no shortage of herbs and natural medications out there that will do that. Some of the ones that I use most frequently will be medicinal mushrooms, antioxidant therapy, compounds like curcumin that's made from turmeric. We use a lot of medical cannabis in our office these days. Cannabis has amazing immune supportive and anti-cancer properties, and more being discovered every day. So really, what we're looking at is a combination, as I say, of nutrition and Western medical therapy and whole body support and anti-cancer herbal therapy, and all of that gets interwoven together to get to a better result.
Better results, that's the key. Weaving together Western medicine with traditional Chinese medicine, with natural medicine, with whatever it will take to make the pet better. Dogs are carnivores. Cats are carnivores. This means that they eat meat. Did you know that there's a plant that's considered to be a carnivorous plant? It's called the Venus flytrap. It catches its prey, mainly flies and spiders, and then it digests them. Have you ever heard of carnivora? That's an extract of the Venus flytrap. Could this be one of the suppressed treatments for pet cancer? Let's hear from Dr. Alan Schoen. You also have some experience with carnivora?
Yeah, interestingly enough, again, what I was doing, there was, back then, there was really only one alternative newsletter. It was the Townsend newsletter for doctors. And I would get that and read and see everything. And I was reading about carnivora, which is an extract of the Venus flytrap, and Dr. Muller in Germany. And I thought, wow, this sounds very exciting. So I contacted him. And again, I was just this naive idealist, And he said, oh yeah, and he said, we've done a little bit on dogs, but yeah, I can send it to you. And I said, and this was the injectable, not the oral. So he said, but you have to get FDA approval. So I applied to the FDA and I got approval to do a clinical trial on it. And so we started using it, and to my surprise and elation, the animals were doing really, really well on it. Then I went to reorder it, and Dr. Muller said, oh, the FDA has stopped, I can't send it into the United States anymore. And I said, oh dear, and so I had to put those dogs on other things, but the carnivora, I watched one tumor after another shrinking.
Why would the FDA make it illegal to import carnivora when it was proving to be so beneficial at shrinking tumors during the clinical trial? Think about it. Last year, I visited the office of Dr. Marty Goldstein in upstate New York, and he described to me an innovative procedure that he's been using at his veterinary clinic since 1971, the same year that President Nixon declared the war on cancer. Let's have a listen.
We have been doing cryosurgery in this practice since 1971.
What's cryosurgery?
Cryosurgery is controlled frostbite, where you actually freeze a tumor, and then whatever gets frozen dies. The advantages of cryosurgery is it could get to tumors that conventional surgery can't get to. It's less invasive because you're not cutting around it. There is less bleeding. There is less sedation. And it actually is the only form of surgery known to be immune stimulating. That's been proven scientifically, both locally or regionally and systemically. As the tumor dies, it stimulates what's called the cytokine production against the tumor, and it's tissue sparing. Part of the tumor that gets frozen gets converted into scar tissue. So it's like having your cake and eat it at least 5 times. Even though cryosurgery is immune stimulating, surgery doesn't cure cancer. The best thing that surgery could ever do is remove the symptom of an immune deficiency. Here's a great case that we use almost as a paradigm. It's a 13-week-old puppy that's owned by a breeder. Look at his foot. I'll give you a close-up. Highly aggressive mast cell cancer. This dog is 13 weeks old. It spread to his lymph node that was actually biopsied as highly aggressive cancer cells, and his spleen was enlarged. The breeder who owned the dog went to his veterinarian and asked him what to do, and he recommended amputation of the leg in conjunction with or followed by chemotherapy because it was a systemic cancer. The breeder said, I am not going to do that. And the veterinarian referred him to 2 board-certified oncologists. One routine oncologist, the other one is a radiation oncologist. They recommended 25 radiation treatments, 5 days a week for 5 weeks, in conjunction with or followed by chemotherapy. The breeder had a copy of my book and read the section on cryosurgery and asked his veterinarian, what about cryosurgery? And word for word, the veterinarian said, that kook, do not go there. I know who you're talking about. So went to the oncologist, came down here. I actually called one of the oncologists and I discussed it with him. He was upset that the dog was here because we're not qualified to handle a case of this severity. And I asked him what was his prognosis, and he said, I give this dog about 5 months to live. Not so much the severity of a cancer in a dog so young, but the severity of the therapy needed to try to put it into remission. He said he would not speak to me until the end of January of 2005, because statistically that's when he assumed the dog would be dead, regardless of how well we did the first 4 or 5 months. That's me freezing the tumor. That's a cryosurgical probe. That's the tumor being frozen. This didn't cure anything, it just saved the foot. Gave us the time to put the dog on a whole intensive nutraceutical program for his metabolic imbalances, for his immune system, and anti-cancer. That's 1 week later. That's 2 weeks later. That's 5 weeks later.
Wow.
That's 2 weeks after they said the dog would probably statistically be dead. That's the dog and the breeder at 7 months of age. He's 25 pounds heavier than any other dog in the litter. When I wrote my book, Cancer is the Ultimate Excuse to Get Healthy, that's 1 year almost to the day.
That's
the
amazing.
other part of this paradigm is all 3 veterinarians that were associated with this case that saw these pictures and knows how well this dog did never called here. We went to film this dog 4.5 years later for the Martha Stewart show. Martha gave me my own radio show. I presented this to Martha and she said, I want this dog on my show. I called the breeder and I said, it's his big chance. Martha wants him on the show. And he said, unfortunately, I adopted him to a weightlifter in Virginia because he ripped my rotator cuff out of my shoulder and destroyed 2 of my stainless steel runs. I've never had a dog this healthy in my 30 years of breeding, 28 years of breeding. The answer, to cancer is health.
Are you enjoying today's show thus far? Are you learning a lot of great information? Do you want to join our movement and support our mission to inform the world on the truth about pet cancer? Then please consider supporting our cause by owning the complete series. Your support allows us to continue spreading the truth absolutely free, just like we're doing right now. And as always, a portion of each and every sale gets donated to charities that are doing real research and are focused on protecting our pets and keeping them cancer-free. Simply click the banner below to join the movement and support our mission. Thanks in advance. Now, back to the final episode of The Truth About Pet Cancer. We just heard from Dr. Marty Goldstein. Now, in this next segment, Dr. Rick Palmquist describes how he initially met Dr. Marty about 30 years ago.
I had this client. She was like the sweetest, most innocent, you might even say gullible person in the world. If it said DVM after your name, she thought that was an acronym for some relationship to God, right? So whatever came out of the DVM's mouth, if you had the stethoscope, the badge of authority, whatever you said was true. And she moved from Los Angeles to New York. And about a year went by, and one of her friends, who was a client here, came in for just a routine rabies vaccination. And she was like, "Oh, did you hear what happened?" I was like, "What?" She's like, "Oh, she moved to New York, and her dog got cancer, and she got hooked up with this crazy quack guy who's like selling her like $500 worth of vitamins and herbs every month, and treating her cancer without chemotherapy." I was incensed. I was so angry that I couldn't sleep at night, actually. Like when you live next door to somebody who's a pedophile and they're raping their daughter at 2 o'clock in the morning, it disturbs your sleep and you need to do something about it. And I was going like, I don't know what to do. I don't this is New York. I don't know anybody in New York. And then finally it was like, I know how to get this guy's license revoked. I'm going to get him out of our profession. I'm going to remove him from our profession. So I called him on the phone because I wanted to ensnare him. And this is all true. So I called him on the phone right from my office in the other room. And I said, "Can I talk to Dr. Goldstein?" And this receptionist said, "Let me check." And a couple of minutes later, she said, "He'll talk to you." And I was like, "Whoa, he's going to come right to the phone." I was like, "Great." So like, "Hi, it's like, I hear you cure cancer." And he says, "Oh, we don't cure cancer." It's like, "Oh, so tell me about that." He goes, "Oh, no, we don't cure cancer." He says, "What we do is we treat the immune system. And by making the immune system stronger, sometimes really miraculous things happen." And I'm like, aha, this is how he gets away with it, right? He never promises to do anything. He just says, "Oh, we're going to make your immune system stronger." Okay, now I got his whole scam, right? So I said, "Hey, I've been wanting to do a little bit of research into this. I'm really interested. Can I come out and see your practice?" And I fully expected him to go, "No," right? Just like that. And he's like, "Oh, yeah, sure. Anytime." That floored me. I didn't know what to do with that. And so I went out there and he said, "Well, wait." I'm like, wait, this is it. He says, "You can't come right now." He said, but actually what's going to happen is I'm going to be doing this seminar. So if you fly out on a Sunday, you can go to my seminar. It's an 8-hour seminar on natural healing. And then when you come to my practice on Monday, then it won't be mysterious. You'll know what we're doing. It's like, oh, this guy's laying the whole thing out for me, man. I can just go, take my little pictures, and the next thing you know, we're going to shut him down. So I flew out and I actually spent a week with him. And it includes actually having a dog that was completely paralyzed, brought in, owned by this guy who was like a big oil executive. And the dog was completely paralyzed and been declared hopeless by the neurologist, who at the time was like the top neurologist in the United States, Dr. De La Junta. He was the guy who wrote the textbook that I studied when I was in school. And Marty put in a bunch of needles, and 20 minutes later, this paralyzed dog stood up and walked over and put his head in the owner's lap, and I fainted. I literally blacked out. I didn't know how to even process what I'd seen. So anyways, after spending a week with him, the last day that I was there, I said, "I have to tell you, that I came out here." So I have this Boy Scout personality. I had to tell him the truth. I couldn't just leave, And so I said, "I have to tell you that I came out here to get your license revoked." And he was like, I expected him to just punch me in the face, and he didn't. He just leaned forward and his little eye glints, this little light comes out of him, and he was like, "What do you think now?" I said, "Well, I think you should get the Nobel Prize because the stuff that I've seen here is just like mind-boggling." And then he was like, "What's your problem?" He said, "You came out, you saw the place, you figured this stuff out." He said, "I think you guys are pretty nice to do that." And I said, "Well," so he and I have been like friends ever since.
I met Dr. Marty about 30 years ago when I had an experience with my cat, Charlie, a little tuxedo cat. And he was my firstborn, so for me, he was my first cat, so it was very special. And he got ill, and we took him to a traditional doctor up here in Connecticut, and they opened him up, closed him up, and said he has liver cancer, and he's going to die within 30 days. So that wasn't acceptable to my wife or myself, so what we did is we came over and we found Marty Goldstein through friends and word of mouth, found Marty, and Marty put him on nutraceuticals and some herbs, and I wasn't really even sure what he was doing at that time because it was all magical to me. And Charlie lived for 8 years in perfect health as like he was a little baby. And it was great. And then he passed.
Wow, that's awesome. So Dr. Marty gave you another 8 years with your pet.
8 years, and I mean, good years, not just, someone just laying around on a cabin. This cat was moving around all the time. It was perfect.
There are so many theories right now on the proper way to treat cancer. And you know what? There's no one magic bullet. There are many different, Ty, you come to me, what can I do to get healthy? You could exercise, you could go on a fast, you could take supplements, you could do a detox. There are many different ways to get healthy.
Hopefully you're learning that what Dr. Marty just said is absolutely true. There are many different ways to get healthy, and most of them include some sort of combination of supplements and herbs and roots and glandular extracts, and the list goes on and on. And one of the things you mentioned, using Western herbs and Ayurvedic herbs, it reminds me of the story of Harry Hoxsey, right?
Right,
Harry
exactly.
Hoxsey, his horses
Yes.
knew what herbs to eat when
Yep.
they got sick.
Yep.
What are some of the herbs that you're using?
So, and actually we do use Hoxsey formula, and we use Hoxsey formula with bone set for osteosarcoma bone cancer very regularly, and that was his original treatment. We also use Essiac-T, which also came out from the human realm. We use poly-MVA. So we use a lot of things that we steal kind of from the human literature and human success cases, because in essence we know that mammals are mammals and that most animals respond very, very clearly in the same manner.
Right.
So a lot of herbal options. So we'll use turmeric, we'll use curcumin, IV vitamin C. There's some really great options out there when it comes to natural ways that we can help support the immune system. Thymus extracts and glandular therapy also can be very beneficial.
That was something that Dr. Nicholas Gonzalez used in humans.
Of course, and proteolytic enzyme therapy. We use a lot of enzyme therapy for certain types of cancers to help the body recognize what's happening.
Licorice is a wonderful anti-inflammatory. It's actually kind of nature's steroid, so we can use that to kind of calm things down sometimes. Astragalus is a great immune booster. Echinacea is an immune booster, and it kind of depends which part of the body you're trying to support.
My favorite supplement is plant-based minerals, because we cannot make minerals, and based on hair testing that I've done for years now, I see that many dogs are depleted of nutrients. And plant-based minerals provide the building blocks to our body. There's 37 trillion chemical reactions happening in the body every second. And if these building blocks are missing, the reactions cannot be conducted in the proper way, and they start sputter like an engine that is on wrong fuel or doesn't have fuel, right? And when you give the natural plant-based minerals, they actually occupy the cells and the receptors, the spots, the seats, like on an airplane, right? Imagine the minerals are sitting down, and if the flight is salt, then the toxins cannot come in and compete with the good minerals. But if a body is depleted, then these toxins can settle in, and they will prevent the good minerals to settle down. But if we give nutrients and minerals in the right amount, they not only support the 37 trillion chemical reactions every second, but they also push out the toxins.
There is an old adage, you are what you eat. I do not think that's true. We are, and you are, and they are what they metabolize. You take a car that's out of tune, and you go around to different gas stations and put the highest quality gasoline in, it's not going to utilize the gas until the mechanic tunes up. So I'm more into a high quality diet. Raw is the most ideal, but into the supplementation so they'll utilize the diet that they're eating.
I've been a physician for over 3 decades and interested in health for much longer than that. And the more I study it, the more confident I am that it's really pretty simple principles. It's not that hard to be healthy. Your body and your pet want to be healthy. They are designed to be healthy. They are not spontaneously going to become crippled with disease. If you give them the right food, enough movement and exercise, sunshine, pure water, you know, it's pretty hard to overcome that. And avoid poisons, and there's a lot of poisons out there, you know, like EMF is a poison. Then the normal, natural immune function and metabolic processes you have to optimize your health will be activated, and you'll get healthy.
And isn't that what every pet parent wants? To see their pet get healthy? To see positive changes in their pet? Remember, these positive changes are more easily accomplished if you're able to detect cancer early before it has spread. One of the early detection techniques that Dr. Marlene Siegel and her daughter Alyssa use in their Tampa veterinary clinic is called thermography.
So with thermography, we're looking at the heat differences in the body. So as you can see, the white around her eyes, the eyes are the hottest organ in the body. Her ear canal is a little warm in there, very warm. And then the blue is cold. So we look at different parts of the body and we take images, and then I have my software can label the heatness from the coldest spot to the hottest spot. And I can do different ranges. And we can see that her liver down here in her abdomen is a little warm. Her armpits are a little warm where her harness is. And we just take images all the way around the body. Focus.
This is our magnetic resonance machine. It does PEMF, or pulse electromagnetic frequencies. So we're made up of energy, the dogs are made up of energy, and this machine produces energies at the level of our normal tissue. So it's a very, very low frequency. We say it's in the picotesla range, so it's very low. Your cell phones are exceedingly higher than that. MRI machines, exceedingly higher. So these are the natural frequencies that are produced by our body. What happens sometimes, like you're driving down the road and you're losing the radio station and you're not getting clear signal, sometimes our cells get out of normal resonance and they're not communicating to each other well. So by using this machine, we can reset the frequency of the tissue to go back to normal. And the hallmark of this machine is actually in reestablishing the normal autonomic nervous system, which has two components to it. You have a sympathetic side and a parasympathetic side, and they live on a teeter-totter from each other. When your sympathetic side is high, your parasympathetic side is low. Your sympathetic side is the one that keeps you alive when danger's around, so that you can run from the bear and fight the danger. In a normal situation, your sympathetic tone would come back down when the danger's gone. And then your parasympathetic side would come up, and then the healing would occur. So all the damage that you did from that high cortisol level would start to be repaired, and your digestion would improve, and your kidneys work better, and everything returns back to normal. Well, the problem in our society is that we never allow that sympathetic side to come down. So you stay in really high cortisol. When you come into the machine, one of the first things that we do is we balance the autonomic nervous system so that the cells become in resonance again, they can communicate, and we raise the parasympathetic side, we lower the cortisol tone, the sympathetic side, and allow the body to start working again.
Dr. Marlene, what was the herb that you used on the dog's leg?
Neoplazine.
What's it called?
Neoplazine. It's a derivative of bloodroot.
Okay. Yep.
Has to be used carefully. There's a lot of bad publicity, and it's like any other tool. If you don't use it right, you can have a problem.
Right.
If you use it correctly in the right situation, it's amazing.
Well, it's funny that you
It's like any other tool.
It's funny that you mentioned that, because Travis, get a close up of the back of my neck here. There's a little spot there. I had a basal cell, and I used
Neoplazine on it.
and it's gone.
Wonderful.
Yeah.
Wonderful. I have many different treatments that I suggest. I have one client who has a pit bull rescue, and it had been operated on twice for mast cell tumor before she came to me, and that we're treating this dog with neoplazine, which is a bloodroot extract. And so when this dog pops up with skin tumors, when she came in he had 10 or 15, and so that we would work through 2 lumps at a time, destroy them with the neoplazine. The hair goes back, there's very little scarring on it. This is something the owner, comes in and we talk about which 2 she's going to attack, and then she comes in 6 weeks and we work on 2 more. This dog has no lumps on his body. He's vigorous. You know, he does not look like a dog who's dying from mast cell tumor.
I can testify personally that Bloodroot works very well on many types of skin cancer, both in pets and in humans. Another couple of healing modalities that are available not only to humans but also to pets are chiropractic and hyperbaric oxygen chambers. Chiropractic is gaining popularity among pet owners as a way to treat animals that are suffering from arthritis, sprains, joint pain, and many other ailments. In hyperbaric oxygen therapy, a pet patient breathes almost pure oxygen in a pressurized tube, which brings more oxygen into the bloodstream. Remember, cancer cells do not like oxygen. They are anaerobic, which means that they produce energy without oxygen, but rather they ferment sugar.
And I practiced very, very traditional medicine for the first close to 10 years. And when I was the first thing I was exposed to was chiropractic care for pets. And I came home and I started using it after the course, and I said, oh my gosh, now I feel really bad for all those dogs that I put to sleep because they had back end problems or they had disc problems. And I actually cried about, I had a basset hound that I had put down the week before, and I thought I could have saved this dog. I could have made it walk again.
With chiropractic?
With chiropractic.
So the first thing I had to learn was chiropractic work. And fortunately, my personal chiropractor had become certified in doing animals. So I gave him a call and I asked him to come look at her. And to this day, I will tell you, I've never adjusted a horse that was more painful than she was. We barely touched her and she would almost move to the other side of the stall. She was in such agony, and yet she was out there trying to do her job.
So you can do chiropractic work on a horse?
Yeah.
Now there's even chiropractors out there that are giving pets and horses adjustments and realigning their spine, and it reactivates that energy system within their body to make them stronger and healthier, and being able to live longer, really. I mean, that's really what you want your pet to do, is live a long, healthy life.
Hyperbaric oxygen chambers, for people that are unfamiliar, essentially, this is it's a treatment whereby the patient is put in a chamber that pressurizes with 100% oxygen. And the practical effect of that is what it does is it drives oxygen into the bloodstream and into all of the tissues of the body. One of the limiting factors to healing in the body whenever we have an injury or trauma, the limiting factor very frequently is the availability of oxygen to the cells. There's a group in Texas right now that's looking at treating dogs that have cancer with a combination of hyperbaric oxygen and what's called a ketogenic diet. So ketogenic diet is kind of an extreme version of what I was talking about before as far as nutritional therapy. So in that case, they're looking at high protein, high fat, zero carbohydrate diets in an effort to get the body to convert to what's called a state of nutritional ketosis. There's research in lab animals that shows that the combination of a ketogenic diet and hyperbaric oxygen therapy can have a profound effect on survival time in animals that have really, really serious cancers.
Is there a place where people can go to learn if they have a holistic vet close to them? Is there a website?
Yeah, there is. Yep. So AHVMA, the American Holistic Veterinary Medical Association.org, has a listing or registry state by state and actually country by country of what holistic veterinarians could be in your area, and if not, where you need to pack up and drive to.
Now, many of the veterinarians on the ahvma.org website use oxygen to heal their pets, which we just heard about from Dr. Gary Richter. Which leads me to the next treatment protocol, ozone. Ozone was discovered by Frederick Schonbein in 1840. It's oxygen in a ménage à trois, an activated form of oxygen with 3 atoms. Oxygen is O2, whereas ozone is O3. Now, ozone was originally used to disinfect wounds during World War I. Ozone therapy accelerates the metabolism of oxygen, and it stimulates the release of oxygen atoms in the bloodstream. Over a period of 20 to 30 minutes, ozone breaks down into 2 atoms of regular oxygen by giving up 1 atom of singlet oxygen, leaving a single reactive oxygen atom. It's this oxygen singlet that does most of the work for a cancer patient. Let's hear from Dr. Marlene Siegel describe how she uses ozone in her Tampa veterinary clinic. Could you share with us a few of the ways that you are currently using ozone therapy to heal pets in your practice?
Ozone is one of the easiest, least expensive tools that can be added to a veterinary practice. We've been using it as they call it major autohemotherapy. So we draw blood, it's a very small amount of blood based on her body weight. We mix it with ozone, we put it through a UV irradiation machine, and then we put that back into her. The second thing that she's had is called minor autohemotherapy, where we take a smaller amount of blood, we mix it with ozone, we kind of hit it until we break the red blood cells, and then we injected that around the masses that she had externally. So the little skin tumors that she had, and that stimulates the immune system, and we can see them starting to shrink.
Some are gone.
Mm-hmm. And she's had rectal insufflation, so we've taken ozone and we did it rectally that way as well, which is a little easier than doing the major autohemotherapy, which requires putting an IV catheter in. But the changes in her, she had so much inflammation in her body. She had an ear infection, she had the mass in her mouth, she had gingivitis, she had the cardiomyopathy going on, she had the irregular heartbeats, she had the masses in her body, and she had the infection in her mouth. So there was a lot of inflammation going on when we started. It took less than 4 days for the smell in her mouth to be gone. You can still see the mass, it's not growing, but what a difference in her attitude and her appetite. As she's losing weight, there's a lot of toxins in the fat, so we made sure that she was able to eliminate those toxins.
Dr. Marlene just mentioned rage. So let's go back to that same interview and ask Dr. Marlene and Casey Krejci to share the rest of the story about Rage, the Krejci's boxer who had cancer as well as cardiomyopathy. Now, since we filmed this interview several months ago, Rage has gone to pet heaven, but it wasn't from cancer. It was actually from heart failure due to the cardiomyopathy. However, I wanted to share this story because it really exemplifies how the pet parent can work with the veterinarian to extend the pet's quality of life.
We had an issue with the dog where she had a few lumps on her head and she had bad breath. And my daughter Grace wanted us to get her to the vet because something's wrong. She was acting right, but something was wrong. So I talked to the vet, and the vet said, well, we'll have to give her a flu shot if she comes in here. We don't have to go very far into truth about vaccines to understand why. No way we're going to do that. This precious lady, we met at TTAC where Monica and I were speaking, and she's a vet, a really solid, holistic vet. And so we took Rage over there for her to check her out. We decided that we're going to do a radical program together. So we had been working on, and finally this pushes into developing a living fuel version for dogs. Now the human version's for humans, and dogs have specific needs. So this dog version we're going to give to the dog, which is radical nutrition. She took control of this, and she did all kinds of other stuff, but she had radical nutrition for this period of time. And speak to some of the stuff that you did there, Marlene.
So the first thing that we wanted to do is make sure that we eliminated all sources of toxins coming into her body. She's wonderful. And so we started with her diet. We made sure that we took her off all of processed foods, and we made sure she got on a raw diet, and that Casey put together the nutritional products so that she had all the essential nutrients that she needed and more. So he has anti-inflammatories in there. It's a very robust product. And then we got working on her gut health, and we made sure she was on bone broth and milk kefir and all the things that we wanted to do to heal the gut. And then we started a little bit of a detox. She had a lot going on, so you don't want to just slam them. We got to get the organs of elimination going, and so we were doing that. She had lots of ozone therapy. She had ozone as a major autohemotherapy. That's where we draw blood, and we mix it with ozone and UV irradiation, and we put that back into her intravenously.
Apricot seeds.
And she had apricot seeds, and she, well, B17, both injectable and oral. And she's on lots of enzymes.
So Marlene just basically does whatever you can do that's positive. All humans would just beg to be able to go through these protocols that she put her through. And so we're talking 2 weeks later now. She has no bad breath. Most of the lumps are gone. She's, you know, she has 2 weeks. 2 weeks. I just felt on her chest. She had a major one right here. It's gone.
The one in the mouth is still present, but it's not growing.
And it's not smelling. There's no odor from the breath whatsoever. She's in perfect, you know, she's excited, she wants to run. There's just so many, you did live blood analysis.
Yeah, the live blood was amazing. I hope we can add that into the piece here, because when I did her initial live blood, she had a lot of sticky cells, and she was, as we started to do in the B17, she started detoxing big time. So we saw particular cells that are indicative of detoxification through the colon. And then 4 days later, as we continued our therapy with magnetic resonance and doing the ozone and all the other therapies that we were doing, we did energy work, chiropractic work, all of a sudden we could see her cells separate. They got beautiful looking, and the amount of toxic cells have reduced almost to nothing.
She's like doggy spa. It's pretty awesome what she did here. But the one glaring point here is, here I am, a leader in superfood nutrition, and that's what I do. But when we think about our dog, you've seen me feed the dog, you filmed it before. You've seen Joshua feed the dog, right? Basically, we need to start thinking more about, you know, if you want to have the impact that we have in ourselves and all the people that we advise, then we need to do the same things for the dog. Well, I appreciate everything you did for Rage, and Rage does too.
You're welcome.
I try to be non-judgmental and just like say, just look at risk benefit and ask, what is the benefit? What is success rate? And say, is that what I want? And that's what I love about doing the more natural, holistic approach is the animals don't know. They're not going, oh, I have cancer, what am I going to do? You know, they're just like living. And if they're having chemo, radiation, if they're having side effects from it, they're not really having a great quality of life. And unfortunately, I've seen too much of that.
The cancer industry is losing the war on cancer, but we, the people, are winning the war on cancer through alternative information, complementary medicine, nutritional knowledge, and independent science. So the establishment will never solve cancer. It's not really their priority. Cancer has already been solved. Millions of people have cured cancer, but not by turning to the establishment. They've done it on their own or through independent sources like this. If you have a pet with cancer, my number one message to you is that there's a very high likelihood that you can reverse that cancer or at least greatly improve the quality of life and eliminate many of the symptoms of cancer. Cancer is not a death sentence for your cat or dog. It's not. There are easy ways, in most cases, to reverse cancer as long as it hasn't progressed to advanced stages. Your veterinarian probably isn't aware of those options because they were never taught those in veterinarian school. But if you learn them, you can apply them, and your pet can probably be saved.
It's just an exciting time, and part of our mission in life is to make cancer a footnote in history. You know, the hospital that's named after Olivia in Melbourne used to be the hospital called the Hospital of the Incurables, you know, in the 1800s.
The TB it was in those days.
It was tuberculosis, right? But once you get tuberculosis, you know, it's incurable. There's nothing you can do, right? And so they had this Hospital of the Incurables, and they say, well, we'll make cancer just like tuberculosis, because that was a belief system then. It used to be a belief system now. People are coming out of that with the education, the knowledge, the access, you know, to a whole variety of new supplements and natural methodologies to put this thing behind us.
I hope you feel educated, empowered, and inspired to take the actions that you feel best for you, your family, and your pet. If you feel that you've benefited from this free docuseries, then we encourage you to share it with your friends, with your family, and anyone else that would benefit from this life-saving information. Join the movement, support the mission, save lives. We're a small company that's committed to the truth and to helping save pets. When you support our mission by owning the complete series today, you allow us to continue to research, interview, expose, and share this knowledge with the world absolutely free, just like we're doing right now. If you've learned something, if you've been inspired, if you want to help save pets across the globe, or if you just love how it feels to support a good cause, please consider owning The Truth About Pet Cancer today. As always, a portion of each and every sale gets donated to charities that are doing real research and are focused on protecting our pets and keeping them cancer-free. Simply click the banner below to join the movement and support our mission. Thanks in advance. Thank you so much for watching. Thank you for sharing this information, and thank you for supporting the mission. Have an awesome evening. God bless, and we'll see you on the other side.
Well, thank you for what you're doing, because you are helping a lot of people, and it took a lot of courage to put all these things out there, and you're helping millions of people, so thank you.
And we're happy just to be a part of it.
Yeah.
You know, it's a big mission, and you know, everybody can engage.
Casey, Dr. Marlene, thank you for helping us out today with this information. It's going to be really impactful. So let me shake your hand. I'm going to greet you and thank you, and then I got the ball for Rage here. Ready, Rage? Here we go. Cool.